You look at the world a little differently when you have a job that requires you to wear a respirator. You know there's more danger out there than meets the eye. You may be exposed to invisible or even odorless airborne contaminants like fumes, dust, mist, gases, and vapors that can quickly enter your respiratory system if you're not protected. And once they're there, these toxins can cause anything from short-term nausea and dizziness to long-term disease, even death. Respiratory hazards can be so harmful to your health and well-being that your employer is required by the Occupational Safety and Health Administration, OSHA, to reduce or eliminate them whenever possible. But when airborne contaminants can't be eliminated and are present at or above the permissible exposure limit, or PEL, it's critical for you to wear respiratory protection that's approved for the job at hand, to wear it properly, and to do your part in keeping it clean and well-maintained so it continues to keep you breathing safely. Different types of respiratory hazards require different types of protection, and some of that protection's pretty sophisticated. Your employer is required by OSHA to have a written plan that addresses whatever airborne hazards exist in your workplace. Then your employer has to supply you with a respirator that will keep you safe based on the air contaminants or oxygen deficiencies you're exposed to, and to train you on how to use your respirator, as well as its capabilities and limits. Apparently, this worker missed that training. So what's the right respirator for your job? The answer is, it depends. It depends on the specific airborne contaminants you're exposed to, your level of exposure, the size of the particulates, the oxygen saturation level, the type of work you're doing, and your medical status. Your employer will select and provide the right respirator to protect you based on these variables.
What an employer has to consider when choosing a respirator is first a thorough respiratory protection policy, which includes the concentration levels of the hazards and the appropriate respirator assigned to those concentration hazards to safeguard their workers.
You have to always look at what type of material that they're going to be working with to decide what type of respirator. If it's a refinishing product or if it's actually material that's airborne as far as dust particles.
Your respirator may be a quarter mask, half mask, full mask, or hood. You may be given several sizes and styles of the same respirator type to select from. It's your responsibility to choose the one that fits you comfortably so you can easily wear it for the entire time you're exposed to contaminants. Even though there are many types of respirators, they all do one of two things. They either purify the air you breathe, or they supply clean air. Respirators that purify the air may use particulate filters, chemical cartridges or canisters, or a combination to clean the air before you breathe it in. If your job involves welding, cutting, sanding, grinding, spraying, or cleaning, a respirator with a particulate filter will generally protect you from dust, mist, and fumes created by these processes. There are several types of particulate filters available, including those that are not resistant to oil, those that are resistant to oil, and those that are oil-proof. These classifications make it easier for your employer to select the correct type of filter for your work environment. The most common particulate filter respirator is a dust mask. In fact, according to the National Institute for Occupational Safety and Health, NIOSH, dust masks make up over 70% of all respirators used in the workplace. If you're required to wear a dust mask for your job, you must be provided with respiratory protection training. Particulate filters won't protect you if you're working with gases or vapors. Instead, you will need an air purifying respirator that uses chemical cartridges or canisters to remove gases or vapors through a filter, catalyst, or sorbent. There are super cartridges available for certain combinations of acid gases and organic vapors. But no single cartridge can protect you from all gases or vapor contaminants. Cartridges and canisters are color-coded to help ensure you're using the right one. For example, white is for acid gases and black is for organic vapors. Your employer has to know exactly which hazards exist in order to provide you with an effective respirator. If the exact nature of the hazard isn't known, or when the level of oxygen falls below 19.5%, your employer must provide you with a supplied air respirator.
Generally, they're used in situations where the employee is looking at immediate danger to life and health situations. So you're carrying your air supply into that situation on your back, and you know that it's clean, fresh air for that individual.
Rather than filter or remove contaminants from the air, these respirators supply clean breathing air through one of two methods. The first method uses an air line attached to an air compressor. When you use an airline respirator, it's critical to keep the hose from getting tangled or interfering with your work. Tangled or kinked airlines have resulted in serious, even fatal injuries. The second method of supplying clean air is through a self-contained breathing apparatus, or SCBA. An SCBA is an air tank carried on the user's back, such as firefighters use. An SCBA generally provides a 30 to 60 minute supply of air, so you need to monitor the time very carefully if you're relying on this method. SCBA is also used in emergency situations for escape from oxygen-deficient or otherwise dangerous atmospheres, like in areas where ammonia or chlorine are stored. If you're at risk, make sure you know where the emergency escape units are located in your facility and how to use them. These respirators generally contain only 5 minutes of air, so it's critical to use them just as one component of an overall escape plan. Even if the contaminants in your workplace don't exceed permissible exposure limits, you may still choose to wear a respirator. And even when the respirator is optional, you still need information on how to use and care for it correctly. Respirators make your lungs and heart work harder, so you need to have a medical evaluation before you wear one to make sure it isn't dangerous for you. Your employer will ask you to either complete a confidential medical questionnaire or undergo a medical exam. The goal is to review your health history, whether you're experiencing any symptoms of illness, the type of respirator you'll use, and your past exposure to contaminated environments. The information will be reviewed only by a physician or other licensed healthcare professional. Your employer will never see the information. You must be honest when answering the questionnaire. Your health, maybe even your life, is at stake. If the questionnaire reveals any potential concerns, you may need to be further examined by a physician before you're cleared to use a respirator.
If someone has any health issues, asthma, bronchitis, things like that, maybe even just a bad cold, they should not wear a respirator. It may interfere with their breathing and the amount of air that they need.
Even if you pass a medical evaluation, changes in your health can affect your ongoing ability to safely wear a respirator. If you experience shortness of breath, dizziness, coughing, wheezing, chest pain, chest injuries, or if you have lung disease or heart conditions, report these symptoms to your supervisor immediately. If your job requires a respirator with a tight-fitting facepiece, it's crucial to have a good face-to-facepiece seal to prevent contaminants from leaking in. To make sure the seal is adequate, your company will conduct a fit test and seal check when you get the respirator, when you change respirators, and at least once a year after that. You should also have fit testing done again if you've changed physically, enough to affect the fit. Say if you've lost a lot of weight, had cosmetic surgery, or had major dental work done. The respirator should fit you securely, but not too tightly. It needs to stay in place when you move your head or talk, yet be comfortable enough to wear as long as you need to have it on. Check for things like pinching around the ears and nose, and also be sure you know how to secure the straps correctly. You'll be asked to wear your respirator in a normal environment to get used to the fit. And then your employer will check the seal by exposing you to a test atmosphere. By way of example, you may have a qualitative test that introduces an odor, something pungent but safe, like banana oil or smoke. Your employer will then have you make various facial expressions and movements to ensure the seal remains secure. If you are unaffected by the test, it indicates a good fit. Or your employer may conduct a quantitative test. Both qualitative and quantitative fit tests use the same set of exercises, but quantitative testing uses a respirator with a built-in monitor that measures the atmosphere inside the facepiece. Anything that interferes with a good seal around your face is a potential problem. Guys, those beards, mustaches, sideburns, or stubble have to be removed in order to avoid potential leaks. Eyeglasses can also be a problem if you're required to wear a full mask, because the side pieces can interfere with a tight seal. Spectacle kits are available that fit snugly into the mask so a proper seal can be achieved. Or your employer may provide a respirator with a loose-fitting hood. Otherwise, you may choose to wear prescription contact lenses so you have fewer problems getting a good fit. Once the fit test is a success, you'll be issued your respirator. When your health and life are at risk, it's never safe to simply assume that your respirator is in good operating condition. You have to check your respirator each and every time you put it on, and double-check the seal once you're wearing it. Start by carefully examining your respirator. Check to make sure valves are secure, clean, and operational. That the facepiece, straps, breathing tubes, and air hoses show no signs of damage or deterioration. And that the filters, cartridges, or canisters are free of cracks or dents, and the service life hasn't expired.
What we do is our students are taught to look the respirator over, see if there's any tears or rips in any of the material before they put it on, actually physically picking it up, opening up the flaps, making sure there's no rips in it, making sure the cartridges are attached properly, making sure the straps are on tightly and on correctly.
Common signs of damage are weather checking around your seal where there's cracking going on, tears in your shrouds, tears in your hose lines, anything where powder can get in. You know, you definitely want to check it over and make sure that you get that changed immediately.
Cracked hoses, dry rot on any of the rubber material, foggy or scratched lenses for vision.
If there's any visible damage, don't use the respirator until it's inspected by someone authorized to repair it. If you don't know how to go about having your respirator inspected, ask your supervisor. Repair may be as simple as replacing a cartridge, or it may be more complex. The point is, don't take a chance. Get it fixed. If the respirator appears to be in good condition, put it on and perform a positive and a negative seal check. For a positive pressure seal check, cover the exhalation valve with the palm of your hand, removing the valve cover if necessary. Exhale gently into the facepiece. When there's a tight fit, the facepiece will bulge slightly. The goal is to create a positive pressure without any signs of leakage out of the facial seal, inhalation valve, or cartridge attachments. Conduct a negative pressure seal check by using your palms to close off the inhalation valves or the inlets for the cartridges or canisters. You may need to wear a latex or nitrile glove to completely close off the inlets. Gently inhale. Your breathing should create a vacuum, and the facepiece should slightly collapse inward without any leakage through the facial seal. If the respirator passes these two tests, it's generally considered effective and safe to wear. If you experience any difficulties with the fit or seal of your respirator, have it checked out. Even a small gap could allow deadly contaminants to seep in. Do not, under any circumstances,